The digestive tract includes the mouth, esophagus, stomach, small intestine, large intestine, rectum, and anus. The pancreas, liver, and gallbladder are accessory organs of the digestive tract that have many functions, one of which is to produce digestive juices and enzymes that aid in digestion. The digestive tract alters food into readily absorbed nutrients and eliminates waste products. Digestion begins in the mouth. Saliva moistens the food, and amylase, an enzyme in saliva, begins the process of breaking it down. Food moves through the esophagus and enters the stomach, where digestive enzymes and stomach acid continue breaking it down. The resultant breakdown product, called chyme, contains carbohydrates, small proteins, minerals, fats, vitamins, and water. Chyme exits the stomach and enters the small intestine. The small intestine digests and absorbs each component of chyme. Pancreatic enzymes eventually break down carbohydrates into several simple sugars called monosaccharides. Sodium glucose transporters are responsible for transporting monosaccharides across the intestinal cell membrane into the cell using active transport. After transport into the cell, glucose transporters move the monosaccharides out of the cell and eventually into the bloodstream for use by the body. Enzymes called proteases break down proteins into amino acids. Like carbohydrates, amino acids such as glycine are co-transported with sodium ions via the sodium glucose transporter. Various amino acid transporters then transfer amino acids into the interstitial fluid, where they are available to build proteins needed by the body. Minerals such as sodium are co-transported with carbohydrates and amino acids. Liver bile salts emulsify fats. Then pancreatic and intestinal enzymes digest them into fatty acids and a glyceride. Bile acid droplets, called micelles, absorb the fatty acids and a glyceride, as well as any fat-soluble vitamins in the chyme, and deliver them to the intestinal cell wall for absorption. Within the cell, the lipids and fat-soluble vitamins are packaged into chylomicrons, which are delivered to the lacteals, or lymphatic capillaries, in the intestinal villi for transport to the lymphatic system and eventual return to the blood.
For type 2 diabetes, lifestyle changes are important first steps that can help you control high blood glucose or sugar. These changes may even help you prevent, delay, or reverse the disease. Lifestyle changes include eating a healthy diet, regular exercise, losing weight, and not smoking. You may also need to check your blood sugar, cholesterol, and blood pressure to make sure they are within the target range to help reduce your risk of complications from type 2 diabetes. If lifestyle changes aren't controlling your blood sugar, your healthcare practitioner will prescribe medicines as necessary. Eating a healthy diet may help to lower your blood sugar level. You can help do this by eating a diet with fruits, vegetables, and whole grains. Have meals and snacks about the same time every day. Carbohydrates are substances your body uses to make energy. Ask your healthcare practitioner about meals with the right balance of carbohydrates, proteins, and fats for you. And reduce your intake of high-sugar foods. Getting regular exercise, even just 30 minutes a day, may lower your blood sugar level and may lead to weight loss. Talk to your healthcare practitioner before starting an exercise program. Being overweight is an important risk factor for having type 2 diabetes. This is especially true if you have a lot of visceral fat. This is the fat you can't see that surrounds the organs inside your belly. The good news is that through diet and exercise, losing as little as 5 to 7% of your body weight can help significantly improve your blood sugar levels. You may need to take one or more oral or injectable diabetic medicines to help lower blood sugar. For example, metformin lowers the amount of sugar produced by your liver. It also makes your muscle tissue more sensitive to insulin. Sulfonylureas increase insulin release from your pancreas. Thiazolidinediones make your fat and muscle tissue more sensitive to insulin. They also reduce sugar production in your liver. Alpha-glucosidase inhibitors work in your small intestine to block the breakdown of starchy foods and slow the absorption of some sugars. This keeps your blood sugar from going up too fast after you eat. DPP-4 inhibitors let helpful chemicals in your digestive system stay active longer. These chemicals help lower your blood sugar level. GLP-1 receptor agonists increase insulin release from your pancreas when you're eating. They also slow digestion. And SGLT2 inhibitors increase the amount of sugar removed from your body and urine. If your diabetes cannot be controlled with diet, exercise, and other medicines, your healthcare practitioner may also consider insulin. Insulin that you inject helps to replace the insulin your body would normally produce. A healthcare practitioner will train you to inject it just under your skin. You may need to check the level of sugar in your blood with a blood glucose meter. Ask your healthcare practitioner how often to check. To do this, you will prick your finger with a small needle called a lancet. Then, you will place a drop of blood in the blood glucose meter, following the directions provided with your meter. Based on your blood sugar level, you may need to adjust your meals, physical activity, or medicine dose as directed by your healthcare practitioner. By treating and controlling your blood sugar level, you may help prevent the complications from type 2 diabetes. For more information about treatment for type 2 diabetes, talk to your healthcare practitioner.